Some mornings, the hardest part of your whole day happens in the first 10 steps out of bed. Your knees don't want to bend right away. Your hips feel stiff, almost rusted shut. You get to the top of the stairs and think about it before you go down. If that sounds familiar, you already know something no doctor needs to explain to you. Joint pain doesn't just hurt. It shrinks your world, one small decision at a time. The walk you skip, the jar you hand to someone else to open, getting down on the floor to play with your grandkids and needing a hand to get back up. Here's what most people don't know. There's a real, documented reason a spoonful of the right olive oil can actually help with that ache. And it has nothing to do with folk remedies or wishful thinking. It comes down to one specific compound, discovered almost by accident, that acts on the exact same pathway as the pain reliever already in your medicine cabinet. By the end of this video, you'll know exactly what that compound is and the precise method for using it, so you're not wasting a good bottle of olive oil on nothing. Let's get into it. Quick thing before we go on. If you're dealing with joint pain and you're 60 or older, hit subscribe now because this channel is built for exactly this. And tell me in the comments, is it your knees, your hips, or your hands giving you the most trouble these days? Let's start with what this actually does for you, in plain terms, before we get into the story behind it. There's a compound naturally found in good, fresh olive oil that acts on the same chemical pathway as common anti-inflammatory pain relievers. It doesn't heal worn cartilage, and it's not a cure. What it can do is help calm the chemical alarm signals your body sends out when a joint is irritated. The same signals responsible for a lot of the swelling and extra soreness layered on top of ordinary wear and tear. That's the real, documented benefit. Not a miracle, but a genuine, science-backed reason to look twice at the bottle already sitting in your kitchen. And later in this video, I'm going to walk you through the exact method, which olive oil actually has enough of this compound to matter, how to tell a strong one from a weak one just by tasting it, and how much you actually need each day. Most people get this part wrong, and it's the difference between wasting your money and actually getting something out of it. So stick with me. But first, you should hear how anyone figured this out in the first place. It starts in 2005 with a scientist named Gary Beauchamp. He wasn't looking for a pain reliever. He studied taste and smell for a living at a research center in Philadelphia called Monell. He was at a food science conference in Sicily, tasting different olive oils, when one fresh, high-quality oil gave him an unmistakable sting in the back of his throat. He'd felt that same sting before, from swallowing liquid ibuprofen years earlier during an old research study. Two completely different things. One, a common pain reliever, the other, a kitchen staple. Somehow, his throat reacted to both in almost the exact same way. That single memory was enough to make him wonder if it was a coincidence or a clue. So he brought the question back to his lab. His team tested fresh olive oil, isolating compound after compound, until they found the one responsible for that sting. They gave it a name that tells you exactly what it is: Oleocanthal. Oleo for olive, canth for sting, al for the part of its chemical structure. Sting of the olive, basically. Then came the real discovery. When they tested how oleocanthal behaves in the body, they found it blocks the same two enzymes that ibuprofen blocks. Different shape, different origin, same target. The study was published in September 2005 in Nature, one of the most respected science journals in the world. Olive oil isn't just a healthy fat sitting quietly on the shelf. It's doing something active inside your body, how it actually works inside your joints. So what is oleocanthal actually doing? To understand that, it helps to know what's going on inside an aching joint in the first place. Most joint pain after 60 comes from osteoarthritis, the slow wearing down of the smooth cartilage that lets your bones glide against each other. As that cushion thins, bone can start rubbing closer to bone. That's the mechanical part, and it's real, and no oil fixes that on its own. But here's what most people don't realize. Your body doesn't just sit there quietly while that happens. It reacts. It sends out chemical alarm signals, molecules whose whole job is to tell your brain, something's wrong here, pay attention. That reaction causes swelling, heat, and extra pain stacked on top of the wear and tear that started it. So a good chunk of what you feel isn't just damage. It's your own body's alarm system, turned up louder than it needs to be. That's exactly the piece both ibuprofen and oleocanthal interrupt. Not the wear and tear itself, the alarm. Inside your body, there are two enzymes called COX-1 and COX-2. Think of them as switchboard operators. When tissue gets irritated, they're the ones who put the call through for pain and swelling to ramp up. Both ibuprofen and oleocanthal get in the way of those two switchboard operators, so fewer alarm signals get sent. Not a similar mechanism, the same one, confirmed in lab research, blocking the same two enzymes. If your brain just went, "Oh, that actually makes sense," do me a favor and tap that like button. It helps this video reach other people dealing with the exact same aches you are. Now here's the part most videos on this topic skip, and it's the part that actually matters most for you. In that original 2005 research, the amount of olive oil tested was about 3 to 4 tablespoons a day, roughly 50 grams. At that amount, the anti-inflammatory strength researchers measured was about 1/10 of a standard adult dose of ibuprofen, not equal to it, about 1/10. A single spoonful is even less than that. So let's be completely honest with each other. 1 tablespoon of olive oil is not going to shut off a bad flare-up the way a pill can in 20 minutes. If anyone tells you it works exactly like a pain pill in that amount, they're not giving you the whole picture, and you deserve the whole picture. Here's what the research does support. Scientists have watched oleocanthal calm down inflamed joint cells in lab studies and reduce joint damage in animal studies of arthritis. That's genuinely promising groundwork. What's still being studied, what nobody has proven yet with large human trials, is exactly how much of that lab effect carries over when you eat normal food amounts of olive oil day after day for months or years. That's the honest state of the science right now, in plain terms. So if 1 spoonful isn't switching off your pain like a pill, why bother? Here's the real answer, and it's actually more useful than a miracle cure would be. This was never about 1 spoonful. It's about a pattern. Research on Mediterranean-style eating, the kind of diet where olive oil replaces butter and processed fats as the main fat in your kitchen, has been linked over and over to lower markers of inflammation in the body over time. Not an instant fix. A slow, steady turn of the dial. The same way years of a rough diet can turn inflammation up, years of a better one can help turn it back down. Think of it less like a pain pill and more like compound interest. A spoonful today does almost nothing you can feel. A spoonful most days, for months, as part of real meals, is a habit with a track record behind it. It's small, it's realistic, and unlike a lot of what gets promised in videos like this one, it's something you can actually start tonight without spending a fortune or waiting on a miracle. If you've already made the switch to cooking with more olive oil, I want to hear about it. Drop a comment and tell me how long you've been doing it and whether you've noticed anything. Here's what I promised you at the start. Not all olive oil on the shelf is doing the same job, so let's get specific. Buy extra virgin, not light or pure. Those lighter, more processed versions have been stripped of most of what we've been talking about this whole video. Extra virgin is the one you want. Check for a harvest date, not just a best by date. Olive oil isn't like wine. It doesn't improve with age, it fades. A bottle harvested within the last year has far more of these active compounds than one that's been sitting around for 2 or 3 years, even if it's technically still fine to use. Taste it. A good, fresh, high-quality olive oil should taste a little peppery, maybe slightly bitter, and it might catch the back of your throat if you take a spoonful on its own. That bite is not a flaw. It's the exact sensation Beauchamp noticed back in Sicily. If your olive oil tastes bland and buttery with no bite at all, it's probably lower in the compound you're after, even if the label says extra virgin. Store it right. Dark bottle or tin, cool cupboard, away from the stove and out of direct light. Once opened, try to use it up within 6 to 8 weeks for the best freshness. Use it consistently, in real food, not as a shot of medicine. Drizzle it over vegetables, salads, bread, cooked grains, a finished soup. 1 to 2 tablespoons spread across your day, swapped in for butter or other fats you're already using, rather than piled on top of everything, is a realistic target. One small note. If you're not used to a strong, peppery oil, ease into it. In some people, a lot of it at once can be a bit rough on the stomach, the same natural irritant quality that causes that throat sting in the first place. Quick myth check. Does cooking ruin it? You might have heard that cooking with olive oil destroys everything good about it. That's not quite right, and it's not quite wrong either. Normal home cooking, sautéing vegetables, roasting a tray of something in the oven, does not white these compounds out. Olive oil holds up reasonably well under regular kitchen heat. What actually reduces these compounds is repeated, prolonged high heat, like reusing the same oil for deep frying over and over. So here's the simple rule. Cook with it however you normally would, and don't stress about it. But if you want to get the most out of every bottle, keep a little aside to add uncooked at the end, drizzled over the finished plate. That's where you'll taste, and get, the most of what we've been talking about. One more honest section, because I'd rather you hear this from me than find out the hard way. Olive oil is not a replacement for arthritis medication or treatment your doctor has already put you on. If you're managing joint pain with prescribed medication, don't stop or change anything based on a video. Talk to your doctor first, especially if you're on blood thinners or other regular medications. It's always worth mentioning diet changes to whoever manages your care, and there are warning signs that call for a doctor, not a spoon of olive oil. A joint that suddenly turns red, hot, and swollen. Joint pain that comes with a fever. Morning stiffness that lasts longer than 30 minutes to an hour, which can point to a different kind of arthritis that needs different treatment. A joint that suddenly can't bear your weight. Or pain that keeps getting worse no matter what you try. None of those are wait-and-see situations. Those are call-and-get-it-checked situations. You know your own body better than anyone. You deserve real answers when something's wrong, not guesswork, and definitely not a home remedy standing in for a diagnosis you actually need. The real takeaway. Let's bring this full circle. At the start of this video, I told you there was a real story behind this and a specific method, not just another vague health tip. Now you've got both. A scientist who tasted a spoonful of olive oil and stumbled onto one of the more interesting food science discoveries in 20 years, and an actual method for putting that discovery to use in your own kitchen. You don't need a miracle to start taking better care of your joints. You need a better bottle of olive oil, chosen well, used consistently, as part of real meals. Not a magic fix, but a small, honest, repeatable habit that actually has research behind it. So tonight, when you're making dinner, take a look at what's already on your plate. Is there a spot where a real drizzle of good olive oil could replace something less useful to your body? That's it. That's the whole ask. Start there. If this video helped you understand your own body a little better, that's exactly what this channel is here for. I'll see you in the next one.